A telehealth service is the use of technology to help people live more independently. This includes personal alarms and health monitoring devices that transfers data from a mobile device to be sent off and monitored digitally or by a nurse or matron who can act on that data according to the results they receive. Here's Phil O'Connell, the global project lead of Stoke-on-Trent NHS, who developed a telehealth system called Florence.
Florence is it's an automated interactive text messaging service, but rather than being just a mechanical, we've actually created a persona, and that's why it's called Florence. So it actually behaves as though it's a person, and you get instant responses back. So Florence might ask you a question or ask you to send in a reading, like a blood pressure, for example, and it looks at that data you've sent in, checks it against what it's expecting to come in for you, and if it might be a bit high or a bit low, and then it sends some appropriate advice back to you, which might be you're okay, or actually you need to look after yourself, or call a nurse to talk about the readings that you've just sent in.
So this type of telehealth doesn't mean that you have to give up on human contact. It's a service that aids the process of contact with medical professionals.
I first got involved with telehealth services through a project that was done in Stoke-on-Trent City Council, and then they were using the legacy type equipment, which is boxes that plug into walls, and patients loved them, but they were restricted to only taking the readings at home. And so we looked into different ways, and probably cheaper ways and more convenient ways of helping patients to help themselves. And that's where we came up with this concept using mobile phone.
And with mobile technology being such a prevalent part of our lives, it seems like a move in the right direction.
The number of people that use Florence at any one time varies, because it's used rather than being for a long term and over a number of years, where a lot of patients do that who've got long-term conditions. Patients can use this maybe just for a week or a few weeks, depending on what the condition is and what they're trying to achieve clinically with their GP or the nurse.
So using telehealth doesn't always have to be a long-term commitment.
Yes, I mean, Florence has won quite a number of awards since the time we've been live with Florence. One of the most recent awards was one for myself with regard to being the NHS Innovator of the Year 2012, which was in December. And that was across the field of the whole of the NHS. And so it's not just an award in a technology category.
Winning such an award does give Florence a lot of credence and suggests that the system Phil created is playing a big part in changing and developing NHS services.
What happens is they'll see it demonstrated and it works. It takes just 20 seconds to sign a patient up to it. And at that moment, they'll think, actually, I've got a patient who might benefit from this. And it doesn't matter what the condition is. It could be mental health, it's used in pregnancy, induced hypertension, diabetes, cancer. It's used in obesity, kidney transplants. It really is a wide field. It's just that how it actually connects with patients, helps patients to send information in, but it really makes that convenient for clinicians and the patient and the interaction that it creates.
So the uses for Florence are extremely varied, and it's a service we could all probably find useful at some point due to this fact.
The future of telehealth in general is far away. If we go into 5 years' time and look backwards, you'd wonder why on earth we were messing about with it now in small bits and pieces. It's just going to be every day. It would just be normal to use this kind of technology to interact with your healthcare provider. That's the future of telehealth.
I'm sure we will look back as we always do and marvel at the primitive technology we at some point viewed as advanced. We'll hear now from Tracy Hall, a former community matron for the Queen's Institute of Nursing, to find out her thoughts on this service.
The patients that I used it with were a very different age range. The youngest was 29, up to somebody in their 80s, because there is that misconception that older people can't text or they can't actually use mobile phone technology, but actually they can. So it's about choosing the right system and giving the patients a choice.
Choice seems to be something patients appreciate and can make a lot of difference to their relationship with their health service.
In Stoke-on-Trent, we used it for people with mental health problems. And there's one individual who was actually living in residential care, and with the help of the telehealth, where the individual was empowered to take medication and self-manage, she actually moved into a flat with support living. So her needs would be very different from telehealth than somebody with a long-term condition that needed monitoring about oxygen and blood pressure readings.
So again, this points to the diversity in uses for telehealth and shows that it can really have a positive impact on patients' independence.
The majority of patients that I worked it really enhanced their care. They were able to self-manage and empower them to actually take responsibility for their own health. Some patients actually increased their anxiety a little bit if they felt their oxygen readings a little bit low. They were a little bit concerned and they did the readings again. But on the whole, it's very positive. But if you work with people and identify which system is most appropriate for them to use, then it was very beneficial.
We'll hear now from Thelma, one of the first patients to use the Florence system, to find out how she finds the service and how she felt when she was first offered telehealth.
Basically, I thought it was a brilliant idea in the respect of if anybody was living on their own, they've got the confidence to know that doctors or matrons were taking note of their stats every day.
So rather than patients sitting at home and worrying, reassurance can be found for many of them knowing that they're being monitored.
I just send my pulse rate, O2 and BP rate on the mobile, and it goes straight through to my matron, and she then knows how I'm feeling. I was one of the first guinea pigs, and I can't remember whether it's 2009 or 2010. But I was one of the first, and there was one other besides me, I believe. I feel quite at home and comfortable knowing that I'm in the background being looked after. Fabulous things. They've done wonders with it.
Well, Thelma is certainly an advocate of the Florence telehealth service, and from the responses we've had from Phil and Tracy, we can only assume that this is a technology service that will continue to rise in popularity and will benefit all parties, from the finances of the NHS to nurses and patients. I'm Steve McGrath, reporting for Password with Peter Warren.